We hear it all the time. Red wine is heart healthy. But is that really true? You might have also come across something called the French paradox. It's the idea that the French have surprisingly low rates of heart disease, even though they eat rich, fatty foods like cheese and butter. So, what's their secret? Some say it's the red wine. But here's the thing. Many factors can raise your blood pressure, and depending on your lifestyle and overall health, alcohol might be one of them. In this video, we're going to take a closer look at whether alcohol, especially red wine, has any effect on your blood pressure. And we'll break it all down by answering 4 simple questions. Question number 1. Are you a social drinker? Someone who just has a drink or two at gatherings? If that's the case, your blood pressure probably isn't affected much. A single drink can cause a short-term spike, but for light drinkers, it usually returns to normal within a few hours. As long as you stop after a couple of drinks, there's usually nothing to worry about. But if you're having more than 2 drinks a day, and doing it regularly, that's when the trouble starts. That quick rise in blood pressure doesn't get a chance to come back down. It stays elevated. And over time, that can lead to serious health issues. Let's move on to question number 2. Are you a binge drinker? Binge drinking means having 4 or more drinks in 2 hours for women, or 5 or more for men. Drinking that much puts extra pressure on your blood vessels. And sometimes, it can push your blood pressure to dangerous levels. Even having more than 3 drinks in one sitting can cause a temporary spike. And if that becomes a habit, it can lead to chronic hypertension. That's because regularly drinking too much alcohol can stiffen or narrow your arteries, raising your risk of heart failure or stroke if you don't keep it under control. And it's even more dangerous if you already have high blood pressure and are taking medication. According to Medical News Today, drinking too much alcohol can interfere with blood pressure medications, making them less effective. Another reason alcohol can raise your blood pressure is because of the high sugar content. Too much sugar often leads to weight gain, and when you're overweight, your body stores more fat. That extra fat puts pressure on your blood vessels, making it harder for blood to flow. So your heart has to work harder, and that can push your blood pressure even higher. All right, let's move on to question number 3. How much alcohol is actually safe? According to the American Heart Association, men should stick to no more than 2 drinks a day, and for women, no more than 1. If you already have high blood pressure, even less is better. Cutting back is a smart move if you're trying to lower your numbers. But if you've been drinking heavily for a long time, it's important to take it slow. Quitting too fast can actually shock your system. When your body's used to alcohol, suddenly stopping can cause a spike in blood pressure that may last for several days. That's why it's best to reduce your intake gradually, with help from a doctor or healthcare professional. Let's move on to question number 4. Does the type of alcohol matter? You've probably heard that red wine is good for your heart, and that's mostly because of something called polyphenols. Polyphenols like resveratrol are found in the skins of red grapes, and they're believed to help protect the lining of your blood vessels. But here's the surprising part. While resveratrol has shown promise in lab studies, there's no strong evidence it actually lowers the risk of heart disease, cancer, or death in humans. And whether it's wine, beer, or hard liquor, the alcohol itself can still raise your blood pressure. So just remember, it's not what you drink. It's how much you drink that really matters. If you enjoy red wine, that's perfectly fine. Just stick to moderate amounts. For older men, especially those over 65, it's best to limit alcohol to no more than 1 drink a day. As we get older, our bodies process alcohol less efficiently, and that means drinking more can raise health risks for everyone. Of course, cutting back on alcohol is a smart move, but it shouldn't be your only focus. Staying active, eating a heart-healthy diet, managing stress, and getting enough quality sleep are just as important. When you focus on all of these, you give your heart the best chance to stay strong and healthy in the long run. If you found this video helpful, give it a thumbs up and leave a comment below. And don't forget to subscribe to Blood Pressure Healthcare for more tips on managing and maintaining healthy blood pressure. Stay healthy, and we'll see you in the next video.